Good day, my name is Ocheje Immaculate Peace, a 300 level public health and nursing student of JPTS, Institute of Management, Science and Technology. I will be presenting a brief seminar on the theme the presence of hepatitis B envelope antibodies in patients who have been previously screened for the surface antigen. By way of introduction, a virus is a small infectious agent having a simple cellular organization with a nucleic acid and a protein coat. It lacks independent metabolism and replicates only within living hosts. Hepatitis B is a serious liver infection caused by hepatitis B virus and can be transmitted from one person to another through body fluid. Symptoms may include dark urine, yellowing of eyes, jaundice, abdominal pain, vomiting, etc. Hepatitis, a general term used to describe inflammation of the liver, which is often caused by a variety of viruses, which include hepatitis A, B, C, D, and hepatitis E. There are various causes of hepatitis. The hepatitis virus belongs to the genus Hepatvirus. It is a partially double-stranded DNA virus composed of a nucleic acid core, a DNA polymer surrounded by an outer lipoprotein coat called the envelope, containing the surface antigen that plays a major role in the diagnosis of HBV infection. The genome consists of a partially double-stranded circular DNA molecule of about 3,200 base pair in length and known sequence, as well as genetic organization. The prevalence of this HB virus infection varies in different countries or regions in the world, as well as in different ethnic groups. HBV endemicity has been classified in three categories: the high, the intermediate, and the low, depending on the prevalence of hepatitis B surface antigen seropositivity. The highly endemic area in the world include the East and Southeast Asia, the Pacific, Sub-Saharan Africa, Nigeria inclusive, and part of the Southern Europe. In Northern Americans and Western and Northern Europe, HBV infection is relatively rare with a prevalence rate of around 0.1% hepatitis B virus. It's a serious global health problem with 2 billion people infected worldwide and 350 million suffering from chronic HB infection. Hepatitis B is caused by a hepatitis B virus. The virus interferes with the functions of the liver. While replicating in hepatocytes, the immune system is then activated to produce a specific reaction to combust and positively eradicate the infectious agents. As a consequence of this pathological damage, the liver becomes inflamed. Vulnerability to this HBV infection is general. Only people who have been vaccinated successfully or have developed antibodies of this HBV infection are immune to this infection. 2 to 6 weeks after exposure, patient enters an immunoactive phase that is characterized by a decrease in this serum HBV DNA and an increase in alt level, and histologically activities indicating paralysis of this infected hepatocytes by the host immune system. HBV antibodies, including antibodies to the hepatitis B called antigen, can be detected between 4 and 8 weeks post-exposure. In the third phase of an acute HBV infection, there is a reduction of serum HBV DNA to below 105 copies per milliliter, normalization of this out level, resolution of any necroinflammation, and seroconversion from HBV antigen to HBV virus. Patients are considered to have resolved the HBV infection when they become HBV antigen negative and develop antibodies to this HBV infection, indicating clearance of this virus. So in conclusion, the presence of this hepatitis B envelope antibodies in patients who have been screened for the previously surface antigen implies that such patients have fully recovered from the infection by HBV virus, hence have developed antibodies against the future infection by this virus. Thank you.